Okay, good afternoon, everybody. I appreciate you making time for me to share some information that I hope you find of value. The topic of today's webinar is Contingency Planning and Execution Strategies for Community Livings and the Healthcare Industry. Quick introduction of myself. My name is John Noble. I'm the Regional of Risk Mitigation for AFIMAC Global. I've got over 22 years in the business, over 150,000 hours managing, or actually in the field, managing picket lines, coordinating some of the largest strikes in Canada. The last several years I've spent working with clients across Canada, helping them prepare for labor disruption. And that includes everybody from manufacturing, healthcare, mining, milling, and anything in between. And probably in the last several years worked with over 100 community livings, CCACs, long care term facilities, etc. So not too much that I haven't seen on the labor disruption side. And the contingency planning side, worked with just about every union that's out there. So I haven't been surprised in a long time. Please feel free at the end to reach out to me, whether it's email or with any questions that you might have. I'd be happy to answer those for you. The old cliche, failing to plan is planning to fail. We've all heard that. We've all maybe used that at some point, or maybe it's new, but throughout the session, I hope to share some real-life experiences, some real-life examples to illustrate how important that is. And we always need to keep in mind that that phrase came about for a reason. The overview of the program for today, we want to establish what your objectives are. And when objectives in our lingo is, what is your operation going to look like during a labor disruption? What is your plan of attack? Whether you're able to operate to full capacity, partial capacity, or whether you're just going to shut off the lights, which is never really an option in the healthcare business. Unlike manufacturing, you don't have the ability. You have critical care that you need to provide, and in most provinces other than Quebec and BC, that might involve the use of replacement labor and your current non-union staff to assist in that. Developing the actual contingency plan, I want to go through some key and critical needs that you do need to go through to develop that plan along the way. The use of temporary labor, what's entailed in acquiring and gathering temporary labor, and what you should be looking for in that area. And then any additional site preparation that you're going to need to make. And then certainly selecting of vendors. This is something that you're generally not going to be able to go alone, and it's important that you select the right people to assist you in the nature of the business and the service that you provide. Establishing your objectives. Establishing your objectives. What is your objective for your labor talks? That's sometimes one of the more important things that you need to look at when you're making your plan and deciding what your objective is going to be. It's something that you can't always determine. You're going to have other people determining that for you, and that's going to make a difference in a lot of different areas. Certainly, you know, is your objective to get a deal at all costs at the bargaining table, endure a strike for a short period of time, or is it something that you're going to endure for a long period of time and willing to sit it out until you reach the objective that you have? In the healthcare industry, from experience, on average, a lengthy dispute is about 7 weeks, but when I speak to clients, certainly it's probably important or critical to prepare for a minimum of a 4-week labor disruption. It's going to be a 2-week usually cooling off period, even if things were going well. It's another week before you set some dates, get back at the table, and another week of negotiations and finalizing. So you should be prepared to, you know, at least be 4 weeks out on a labor dispute if that's the case. And as I mentioned, it's very unique in the healthcare industry in the fact that you don't have that option like a manufacturing business where you can just shut those lights off and you have those critical services to provide. What is your operational plan or objective if a strike occurs? There's client care that you're going to need to, and which is probably the most critical and most important aspect of it. What available resources that you have? Is it going to be a partial operations, which might mean reducing some level of service? Example, on the community living side, it might be discontinuing your day programs. If you have revenue generating sites, used clothing stores, that sort of thing, it might mean not being able to operate those during a labor disruption, that sort of thing. You know, full operation, are you going to be able to operate to full capacity? You'll have to determine whether you're going to use replacement labor, if you have enough resources available to do that on your own, and etc. And will all of the above be considered in different phases? Sometimes when a labor disruption begins, it might not be practical to unleash the whole program right off the bat. You might phase in replacement workers. You might phase in different aspects of it. And those are certainly things that you need to consider along the way. Most of the common assumptions when I meet with clients, and I probably meet with close to 150 clients a year on the labor disruption side of things. Out of those 150 contracts that we might negotiate with clients, maybe 5 to 10 end up in an actual labor disruption. 25 would be a busy year for us. Certainly, you know, the folks that end up in that labor disruption appreciate that they went through the exercise and are prepared. There's nothing worse than being in a position where the union has the foot in the ground, the upper hand. You're not prepared, and that could mean having to negotiate a contract that in the long run is not going to be beneficial for you folks. It might mean a loss of service. It might mean something that you know, that's harmful financially. In the long run, nothing worse than having to reduce service and quality of service along the way. Quite often when I meet with folks, well, it can't happen to me. We haven't had a labor disruption ever, or there's only been one in the 25 years or 40 years that I know of. Unfortunately, those type of situations change from year to year. Most contract or collective agreements are 3-4 years long, and certainly the climate, the economic climate can change, the industry climate can change, and you might just be in the wrong place at the wrong time on the calendar. The union could be setting up or hoping to set up a pattern of bargaining across the board, and that's and you might just fall into that, and the timing might not be right. So it's always critical that you do go through the exercise. One of the areas that I also hear is we have everything that we need. While without developing a plan, without considering a plan, without going through the exercise, without taking, you know, your old plan out, dusting it off, infrastructure, you know, assets may have changed, that sort of thing. There isn't any actual way to know that you do have everything that you need in the event of a labor disruption. And if you're, you know, your staff, for example, in most healthcare businesses, it's labor heavy and management thin. And if you've got 200 people out on the street and you've got 10 management folks that are there, non-unionized folks, it's pretty clear that you don't have everything you need. So it's something that you're going to definitely need to consider. We don't have the budget or the resources. Certainly in the healthcare industry, that's always the concern. That's sort of why you end up in this in the position in the first place to be considering strike planning. But unfortunately, you know, where there's a will, there's a way. And certainly without going through this exercise, you really don't have any idea of what your budget would be, what a labor disruption is going to cost, and what it is that you need, whether you have the resources or the budget or not. If the union decides that they want more, and they end up going through the process and end up in a labor disruption, you've got no choice but to provide that level of service. And so it's important that you go through the exercise to be prepared. And the other one I see, well, we're just going to wait and see what the other groups are doing within our industry. And that's, you know, certainly you want to use those resources. You want to communicate with other folks in your business and within your industry and gather information, find out how things are going, get a gauge on the temperature and the climate. But the one thing that you don't want to be lulled into is complacency, because it might be, you know, the union strategy to lump everybody in a group. Everything can happen very fast, and the last thing that you want to be is caught unprepared as a result of that type of scenario. So it's certainly very important to go through the planning process and make sure that you are prepared in the event of, and if nothing else, it's a great exercise, and you certainly will have less to do the next time around. And then certainly you should always consider the probability versus the consequences when planning, but I would always err on the side of certainly of consequences and possibility, rather than, you know, hoping for the best. Now, what to consider when you're developing your contingency plan. You know, what do we need? You know, logistical support. You're going to need some security. Picket line crossings need to be done in a safe manner. If the union activity isn't allowing you to operate and provide the service that you have the legal right to do, you may need to seek a court injunction. So you're going to need evidence gathered on the picket line to assist your legal folks in obtaining those injunctions, which will which would limit the number of picketers. It could limit how long they can delay, if they can delay at all, where they can picket, if they can picket at all, that sort of things. And so that piece is important. Logistical support, as I mentioned, you need to get people in and out. You need to get supplies and medication, and you need to get people to appointments. Different couriers and mail, they don't deliver across picket lines, that sort of thing. So those are all considerations. Legal, certainly somebody specializing in injunctions and labor disputes is going to be critical. Law is a very specialized industry, and there's certainly people that are experts in that side of the thing, and you're going to need that expertise on your side. And of course, replacement labor, if you're in the provinces that are allowed, that's something that you're going to need to consider. What do we have? It's always important that you do a skills inventory amongst the non-unionized that you're going to have to utilize during a labor disruption. Find out, some of the folks were in the field at one point. They might have certain skills and certifications that are going to be valuable to you, and that's something that without a skills inventory you're not going to be able to figure out. So it's important that you do that exercise, find out what you can utilize, and also find out who what the day-to-day operation is going to look like, and what you're going to need to accomplish that. And in that case, you can decide what extra resource that you're going to require. What is justified? Certainly, you need to look at what your budget is. You need to look at the scenario. If you've got 40 people in your union, you certainly don't need 30 security personnel to manage such a thing, for instance. So it's important that you do your site audits and your internal planning and inventories to find out exactly what you're going to require, and then what is justified in order to provide the critical service that you provide to your clients. Also, what are going to be your risks and vulnerabilities? Doing that vulnerability assessment looking at your properties, looking at your operation, looking at your clients, determining what those needs are. It's important to do that due diligence so that you can prepare the proper measures in order to be prepared and make sure that everything is done and everybody is safe and your operation runs to the capacity that you hope to ensure the safety of everybody involved. And what measures can we take to ensure our clients receive premium care, particularly with the use of temporary labor? It's always a scary thought for agencies and that need to use temporary labor, for instance, on the community living side or long-term care. You've had the opportunity to screen and work with the personnel that you have that are now going to be out on the picket line. It's a bunch of new faces. You don't know what the skill set is. You don't know who those folks are, so it's important that you partner with a professional firm that specializes in the healthcare business or has done this type of work before, that ensures that the quality of people are there, the due diligence and the background screening, etc. is done. You're going to have enough to do leading up to a labor disruption internally, so the more that you can leave to other experts certainly will make your life much simpler. And we all know that certain parts of Canada, it's difficult to find skilled labor and quality people in your industry depending on the geographical location. So it might mean expanding your search, and that's and that's going to take some time and some due diligence on your part. The business continuity planning team, or your planning team, who should lead the team? The one and most important consideration for that, and it's I'm going to stress that it's not a good idea to plan in a silo. You're going to need a team of people to assist you in the planning. If you've been the one that's been tasked to head that up, you're going to need support on that side of things. And if you're leading that team, for instance, in your the human resources manager, and you're going to be at the bargaining table, and you might be locked in bargaining, and as you get down towards that strike deadline, you're going to need somebody on that team that has the ability and is authorized to make some decisions about deployment and strategic planning and that sort of thing when you're locked into negotiations. So make sure that, I know it's difficult, I've gone through the same thing, I have the same personality where you want things to be done right, you do it yourself, but in these type of circumstances you need a trusted team and a valuable team to help you through these type of things. The team should consist of human resources, you're going to need some legal expertise, whether it's in-house or somebody that you've retained to assist for this specific purpose, or somebody that you have a long-standing relationship with. Finance. Labor disruptions create special accounting circumstances. For instance, you might need more petty cash. For instance, you need your purchasing protocols may need to be quicker than what they normally are. You still have to pay people, the staff that's working, vendors, that sort of thing. And with a labor disruption, as I mentioned, circumstances might change on that side of things, so they're going to be a critical part. Somebody that's involved in your programs, facilities and logistics, making sure that sites are secure, making sure that they're safe. Any maintenance issues that go on, there's going to need to be a plan in place to fix those, which could potentially mean crossing a picket line to do that. So it's going to be important that those folks are involved. And then certainly any other critical department leads that provide critical service, you're going to need somebody involved in that to be part of that process. Transportation of personnel. That's certainly one of the more critical pieces. You're going to have picket lines that could be set up at administrative buildings, could be hospitals, could be at access to your long-term care facilities. Picketing generally needs to be done on public property. It can't be done on private property. So there's going to be vehicles that need to get across picket lines. There's going to be people trying to block those vehicles from coming in, etc. So it's important that you have a safe means to get people, management, replacement workers, etc., in and out across those picket lines. And you're going to need to get supplies. You're going to need to get product, medication, groceries, that sort of thing, mail, courier across picket lines, and you're going to need to have a plan to do that as well. So there's two pieces really to the transportation piece. The one thing you're going to first need to establish is how many people are going to need to get across those picket lines and what shifts they're going to be working. Generally, the fewer picket line crossings, the better. So if 12-hour days might be more practical, or longer shifts, people won't be able to get in and out, or should be advised not to get in and out for lunch, coffees, that sort of thing. In order to prepare for getting people in and out, you're going to need the number in order to determine which type of vehicle, what size of vehicle that you're going to need. Will contractors or will temporary labor be crossing? If you have contractors that need to get in to fix things, you might they may want to assist, but may not want to come in their own vehicles that are marked in Bill's Plumbing, etc. So there may need to be some measures taken to get those folks across. And temporary labor is going to be a target. They're replacing the people that are on the picket line. Never ask replacement labor to come across on their own, walk across. That's just a recipe for somebody being injured and risk and liability in many different ways. How many personnel and what shifts to determine the most efficient way to get in and out. As I mentioned, longer shifts generally are better, fewer picket line crossings, fewer resources are needed, and that's always important, certainly on a budget standpoint. And also, it's it's not necessarily the easiest thing to find people that are willing to cross a picket line to work. So the fewer that you need, the better from both a logistical standpoint, cost standpoint, in those areas. What are your options as far as transportation? Bus, vans, carpooling, etc. Your management staff is going to need to get in and out. They may need to go from site to site, so it's important that that logistical piece is worked out. So when somebody needs to get somewhere, someone might have an appointment to get to, there might be a medical emergency or a home emergency that somebody needs to get across a picket line and back to their car or back to their home. So all those pieces will need to be considered during a labor disruption in your planning process, so that you don't have to come up with a plan in the event of something of that nature. Should personnel be allowed to walk across picket lines? My recommendation is always never, but there are some circumstances, for instance, in larger cities, if you're based in Toronto and people take public transit, there isn't parking that's convenient. Sometimes there isn't an option other than to do that, but if there's other options, I strongly recommend that you do that for safety. Also, having to ask people to walk through picket lines where people are angry, they've been out of work, they're frustrated, it just sets up an opportunity for a personal confrontation, which is not good for anybody, and it's certainly something that you don't want to see on the front page of the newspaper and the media, and you don't want to put your people in that position. Plus, it takes its toll on the folks that are in there working extra hours, doing double duty, and it's important that you keep those folks motivated and fresh and as stress-free as possible under those circumstances, so that they can endure the labor dispute and be productive inside. Will you need marshalling yards? Generally what would happen is there would be a marshalling location set up. People would drive to that marshalling location, and then at that point the van or bus or whatever size vehicle is required would take them to the location. If there's anybody that they're replacing at that point, they would get into the van or bus and be taken back to the marshalling yard or location for drop-off, so that there would be no gap in service being provided to the clients that are required. What do you need to do in an emergency? Emergency vehicles I've only ever heard of in my 22 years being stopped at a picket line once, and that was not very long-lived. It's certainly something, it's huge liability on the union side. It's a very big black eye in the media, and it's dangerous. And in almost all cases, any emergency vehicle that needs to get in will not be stopped at a picket line. But certainly, you know, those type of measures as far as communication, being able to get a hold of the emergency, and then letting the people know on the picket line, letting the security know that there's an emergency, and getting the quick response that's required. Should you have a picket line protocol in place? And a picket line protocol is sort of a gentleman's agreement. Sometimes it gets written down and signed on, and that's an agreement between the company and the union, which sort of outlines how long they can delay, what the picket line procedures are going to look like. It's important that you include security and your legal team. If you do engage in that type of discussion with the union will try to be tricky. They'll set you know, lanes, and you know, 10 minutes for a car coming in and 10 out, and they'll, you know, but it's important that you know, logistically. I'll give an example. I had a client that had about 500 cars that had to get in and out. Their director of corporate security took it upon themselves to negotiate a protocol with the union, came back to me and said, "This is fantastic. I can't believe they agreed to 2 minutes." And I reminded him that there was 500 cars that needed to get in the morning with one access to do that. You multiply 500 times 2 minutes, and there's people that are basically getting in and turning around at the end of the day. So the protocol is not functional, and then in that sense, now you have to be the one that breaks that gentleman's agreement, and it's not the place that you generally want to be if you need to seek an injunction and that sort of thing. So it's important that if you're going to go that route, that you certainly speak it with your legal team and security folks that you've hired to get some advice on it. And some lawyers don't want to engage in that at all, so it's important that that's explored. And will the police help your employees get across picket lines? The simple answer is no. They believe, and they treat this, and this is right across Canada, that it's a civil matter. And unless there's a breach of the peace, which means trespass, if there's a highway traffic violation, if there's violence of any kind, they'll proceed accordingly, but they will not, they won't part picket lines, they won't set delay times. And one of the first things that you need to prove in a court injunction is that you have tried to gain the police assistance and have not been able to, which is generally quite easy to do. But certainly they won't be of much help. You want them on your side. You need to make those phone calls to the police for assistance. If there's long blockages of traffic waiting to get into your facility, they won't part the picket line. They will tell the vehicles on the roadway to move along. So it's important to keep that in the back of your mind, understanding how important that you know, that your legal team is, and your security folks gathering the information at the picket line will be to help you through those type of situations. Transportation of material and supplies. Certainly you're going to need to get supplies, food and meds in, as I mentioned. Have had a circumstance with a community living a number of years ago where the union decided to stop the pharmacy deliveries into the facility. That became a bit of a public issue and it got stopped fairly quickly. You might need to make arrangements for that stuff to be picked up directly at the pharmacy, etc. And having that plan in place to do that, as I said, courier service. Some of your suppliers might not want to cross picket lines, so set up a drop-off location and have somebody pick those type of things up. Groceries, grocery service, those type of things certainly will all need to be considered. If you're moving people into a large facility, for instance, then you're going to need to get larger pickups of supplies and groceries, and when there's picket lines, if you're at a long-term care facility, you might have linen service, you might have food service, that sort of thing. A lot of those folks are unionized and won't cross, so there'll need to be a plan in place to assist you in getting those materials in and out, cleaning, sanitation, all those type of things. Will employees be able to leave for appointments and activities? Certainly, yes. Do I recommend that they go on their daily coffee run, that sort of thing? No. Go out for lunch? No. They should be bringing their lunch, that sort of thing. Eliminate the number of picket line crossings as much as possible. Certainly if you have a client or an employee that needs to get in and out, as I mentioned earlier, that's where you're going to need the support to do that. Simple phone call to we would have our senior project coordinator, for an instance, on our end. Simple call to them, and then the vehicle would be there to get them in and out. On the temporary labor side of things, generally in the healthcare business, as I mentioned, you have a critical service to provide. People depend on critical care and medical attention in a lot of cases, and it's just an option that generally you don't have, whether it's a long-term care facility, CCAC, community living. People depend on the care that you provide, and so it's in most cases it's difficult to get along without the use of temporary labor. You're allowed to do it. It's legal to do that in all provinces except for Quebec and BC. So by all means, it's certainly something that you can do, you should pursue and look into, but there's always a cost to that. So it's important in your planning process to eliminate as much as that additional cost, make things more efficient, get the advice of experts that do it on a daily basis. So what you should be considering: will you be using an external contractor? My word of advice on that, certainly yes, is probably the answer. It depends. If you need 2 or 3 people, then that might be something you can manage on your own. If you have a regular temporary agency that you use and they can provide the workers, that's certainly fine. Labor disruption specialists like ourselves, we have a staffing side of our business that provides that. The big difference in sort of our side of things and a regular staffing agency is it's dealing on a regular basis with staffing compared to dealing with it during a labor disruption, and being prepared to provide people with the expertise and the safety of getting in and out, and without showing up and realizing that they're crossing a picket line and the next day they're not getting on that van because they're afraid, that sort of things. So it's important that you are guaranteed by your supplier that they've done it before, and show a level of expertise in making sure that it gets done. You can't afford to be training new people every second day. Generally, people will be hired for the duration of the labor disruption. They sign on knowing that they're going to be working long days, extended days, without a break. The nature of those folks, that's sort of what they tend to look for anyways. So it's important that that you do your due diligence on that end. How many and what shifts? It's virtually impossible, quite honestly, from my level of expertise, to consider doing things in 8-hour shifts with temporary workers. You require too many. The logistics and housing them, you require too much, and it's just not a cost efficient or efficient way, period, to do it. So it's important that you know, that you consider it as a 12-hour shift over 24-hour period. That's the best way to go about it. Certainly your management staff might be different on that side of things. Their days might even be longer in some instances. But that's all things that you will need to consider when you're developing your plan. Training and orientation requirements. We always recommend that prior to your strike deadline that you have an off-site training and orientation session. That's going to allow you to go over any policies and procedures that are specific to your facility, any additional training that's required, such as you know, first aid, CPR, nonviolent crisis intervention, those type of training. It's you might have somebody on staff that provides that training. You might require a outside resource. Certainly we have our own trainers on staff to assist with that, but there's some options there. And then it also allows you to familiarize yourself with those individuals, get a feel for who they are and who they're going to be best paired up with when they're providing care for, what their strong suits are. If there's people with specific medical requirements, then you have an opportunity to brief those folks and get them accustomed and acclimatized to that situation before actually going in. It's certainly not a perfect environment to work under. The other thing is I always recommend that at each, if it's a group home, for instance, or a facility, that some sort of book that should be available to those folks with a makeup of each individual or each patient that's there or client that's there, and specific information that could help them. And it's always a good idea too, if the resources are available, to have, at least at the start, to have one non-union, one management staff there with a number of replacement workers that you're using. That way there's a familiar face, and that way from a due diligence standpoint you have somebody there to make sure things are getting done the way you want them to get done, in a safe manner that's that meets the expectations of you and your clients and the families that you're providing care for. Make sure that all the licensing, tickets, permits, or make sure that everybody is the proper paperwork and training to do the job that they're doing. The union is going to make sure that if they don't, that the media and the ministry is going to be aware of that, and they're going to make that very public. And so you want to make sure that you do your due diligence on that end, so that you don't have to deal with those type of issues going forward. What to look for when choosing a third-party agency. Ask for references, people that they've done work for. Make sure that they're experienced, as I mentioned earlier, in the strike side of things, that they know what goes on and what needs to be done and how to safely do it. That's the key. And then on the other side is, what can you expect from pickets if we use temporary workers? It does, I won't powder coat it, it does make the environment a little bit different. If it's just management staff that are going in across the picket line and they're providing the minimum service, there's no replacement workers going in and out, the environment tends to be much easier and much less, the mood is much less escalated, we'll say. Once temporary workers get used, those are people that are actually replacing those folks. They use the word scab. Actually, everybody now gets called the scab, but that's sort of the term that gets used. and it does change the environment a little bit. It's not unmanageable by any means, but certainly there will be more emotion to deal with. It certainly attracts more media attention, that sort of thing. But you have a legal right to do that, as I said, in most provinces, and in most cases it's the only option that you have. Certainly you want to make sure that you're aware of the current state of your industry and how it will affect the supply and demand, and that's something that should be done in advance. You want to make sure that the company that you're paired up with does the research. They know how many people are available. If there's 15 or 10 other facilities similar to yours going through the same thing, what is that? What's the supply of those replacement workers like? And are you going to be able to? Is the provider going to be able to meet the promise, meet your expectations or needs, that sort of thing? You should have a good handle on what's happening in the industry and what that supply is like. For instance, have some clients on the community living side up in sort of the Sault Ste. Marie area, for instance. They have challenges finding 1 or 2 workers, employees when they need them. So to replace 50 replacement workers, there's some challenges there. They're going to need to spread their wings, and there's some additional costs. If it's a small town that you're in, you certainly don't want to hire replacement workers locally. That brings things onto their front lawn and certainly makes things difficult for people doing that type of work in a small community. You're going to need to spread your wings. So those are some things to consider. Make sure that the provider has a proven track record. You don't want to avoid empty promises. I ran across a client who was using somebody one time. They had a strike deadline coming up. They needed 75 replacement workers, and it was in the healthcare side of things. And they were very fortunate they settled because the supplier, and getting down to the week before the labor disruption, it was found out that they literally only had 10 or 15 workers that were available to work. Make sure that, that would leave you in a very dangerous situation. Make sure that your provider is sending you a daily update, and they're transparent about who they've interviewed and hired and retained, and so that you know exactly where you're going to be. And it might mean that there's a change of strategy along the way, but it means that you're not surprised and you're very confident and comfortable that you're going to get the workers that you need to provide that critical care. Have your clients' profiles and job descriptions ready. That's something that you should have put together. You probably do anyways, but that's going to ensure that you're getting the proper people hired to look after with the proper skill set. If you have people with specific medical needs, diabetic issues, IV, behavioral problems, that sort of thing, or issues, you're going to need to make sure that you've got the right skill set available to assist. Might be PSWs, DSWs that you need, but there might also be need for a nurse, nursing type skills. So it's important that you know what you need in order to have those resources ready in the event of a labor disruption. As I mentioned, daily reports to make sure that the providers are on track. Set and stick to realistic timelines. And from experience, it takes 30 days to effectively recruit and hire temporary labor. The 30 days is kind of a magic number. In order to get the proper skill set, it takes about 30 days to do that, but you can't generally retain people much beyond 30 to 40 days either, say on our end. So it's kind of that magic number, and there's usually some type of cost associated with that, but I always talk to clients and remind them it's similar to fire or renter's insurance. You can't go to the insurance company and try to get insurance after the fire. So it's You know, and the union's getting smart in the healthcare business. They know you're dependent on replacement workers, so in a lot of cases they'll lead you down the rosy path that everything's fine, knowing that there's some issues, and then all of a sudden the next thing you know they're requesting a no board, and you're not prepared. So it's always important not to assume that you don't need to go through that exercise. It might be a cost that you need to endure, but if you need 30 or 20 or 50 replacement workers, and they end up on strike and you don't have them, or you're at the bargaining table and you know you don't have them, then at that point you have to put yourself in a financially difficult spot, give the union maybe what they need, or risk a catastrophe and not being able to provide care for these the valuable folks that you provide that service to. The other thing is too is how long can you withstand the shortfall in the manpower? It's important that once that you have a plan in place as far as keeping people fresh and redeployed when they need to be. Your management staff is going to get tired. You need to make sure that they're being looked after. There's some downtime. As far as the replacement workers go, you might be a little bit maybe heavy at the beginning, but what you're going to find is if you've got a couple extra bodies around, then they'll start to spell off your management folks or other temporary workers that are there. Everybody has a limit. Ourselves, for instance, in the business, we have already pre-authorization for extended hours of work, but we also know that there's a limit to how much people can endure in order to be safe and have a safe workplace. And then the other is don't take risks on your timelines. That's one of the key things. So the effective use of management and non-union staff to support your temporary workers, I hit on that earlier. Make sure that there is some type of presence, especially at the beginning, and then once you get more comfortable with those folks, then you can begin to maybe wean the management staff and get them back to doing what their regular role is and spending less time back in the field. It's important again for the off-site training prior to the strike deadline, as I mentioned earlier. That's a critical piece. Also included in that should be some picket line safety training that's provided by your security provider in general. Ensure that your provider has time tracking and communication system in place. When you've got a number of replacement workers working, they're working through an agency, for instance, you want to make sure that that time tracking is accurate. And I would recommend having a daily sign-off so that whoever is coordinating on their end and your end, that you're signing off daily on those hours so that you don't have to go back through weeks and months of timesheets and trying to go through that sort of mess. And that way then you've got some accountability on your end and their end onto the hours of work. Strikes are not inexpensive by any means, so every penny counts. So it's important that there is that time tracking and communication system in place, and make sure that your provider, if somebody leaves or isn't working out or is ill, that there is no gap in redeploying a new person into that role. And as I said, don't take risks on your timelines. Use the guide of 30 days and don't put yourself in a difficult position. So when we talk about additional site preparation, it might include some fencing on what needs to be done, where is it practical, that sort of thing. Certainly you want to make sure that the lighting is adequate. During the day you generally deal with picket line activity, people blocking traffic, and at nighttime generally that's where you deal with more, or we deal with more vandalism type issues. So make sure that the lighting is good. and make sure that it's safe. Lock and key control, you want to make sure you know who has the keys to what. Generally, it's probably going to need some lock changes. You're going to need a locksmith probably on retainer or lined up in the event of to change some locks prior to that strike deadline if you haven't, you know, aren't close to getting a deal or it looks like a strike is imminent. Then you're going to need a locksmith to replace those locks. A lot of times it's a good opportunity to regain control of your key accounting system as well. CCTV systems, if you have one, or is the system working? Does it meet the needs? Who has control of those systems and that sort of thing? Do I recommend spending money on CCTV systems? Not necessarily, it's not, but certainly make sure that if you have a system in place that it's a good idea to have it operational and make sure that it's in good repair. Access controls and alarm systems. Can you turn off access? If you have an alarm response company, for instance, they should be aware that there's a strike action that's pending. And it may need, if you're moving, for instance, if you're moving clients into different areas and you have buildings that are now going to be unoccupied, certainly you want to make sure that some type of security patrol or measures are taken in place so that those valuable assets don't get damaged, vandalized. I've had an instance where those measures, the client did not want to put them in place, and somebody stuck a garden hose in a dryer vent, turned it on, and it wasn't discovered for quite a few hours, and the basement was totally flooded, etc. So those are things that, making sure that, outside taps are turned off, garden hoses are brought in, all those type of things are important to make sure that you've got on your list. Knowing who your police is, generally most police forces will have a police liaison or representative. It's always a good idea to make contact with them, usually sooner than later, later than sooner. They're going to be liaisoning probably with the union as well, so the less information that they have, some police forces tend to be a little bit more or less union friendly than others. So it's important that they're on your side. The communication is important. Make sure that you've got a guaranteed response. If there's an emergency, you're going to get the same response that you would under normal circumstances, and build that rapport with them. They're going to be an important piece, certainly. And then certainly the fire department, which department is going to contact. Make sure that you know the bylaws on burn barrels and things of that nature. Unions like to put out the fire barrels and burn it. They can become safety hazards. In the neighborhood, if you've got community livings and such as group homes, you want to create as less chaos on the street, so you want to make sure that those are going to be enforced effectively. Signage, boundaries are marked. Make sure you know where the property lines are. No trespassing signs. It's always a good idea to put those up so that you can enforce the Trespass the Property Act if there's picketing and picketers on your property. Legal representatives, who and how will you communicate with them? One of the most important pieces is communication. It's a critical piece in managing through a labor disruption. It might mean retaining a professional who's, that's what they do. Social media now has become rampant. People communicate through. The last thing you want to be doing is making a tweet or posting something on Facebook, because once it's out there based on emotion. So you want somebody that may not have an emotional stake in it to assist you in making sure the right message gets out. You might want to have some canned messages prepared in advance. Have an expert look over those. Make sure you're not using social media, as I mentioned, in the wrong manner. And as we all know how quickly things spread now on social media. Make sure your non-union staff are trained in the protocols and the policies and procedure about social media. Keep in mind as well that people on the picket line all have phones and can post something to YouTube and Twitter and Instagram immediately. So it's important that your management and non-union staff behave in the most professional manner when they're crossing picket lines and dealing with those type of things. It's known, and it's a history of the union using the media. In a lot of cases, it's misinformation, and there certainly you don't want to get into in bargaining and a battle in the media. So it's important that you have a communication strategy in place. And the other thing is, the one thing I've found through experience is family members, board members, non-striking staff, the public, they require and want information. They crave information, and they get sort of restless and uneasy if they don't get that information. And what I've found is, even by posting something such as there is nothing to report today, there's no further updates, is enough to keep people satisfied and in the loop, so to speak. The other thing is the communication between your staff that's not on strike. Make sure that they're getting a positive message. Make sure they're getting all the information that they need in order to keep them informed and safe and working as a team. That's really, really critical. That's something that you're going to be dependent on through these type of things. Make sure that you have a strategy to keep your management and temporary staff charged, because they're going to need it. Your management staff is going to be, they may be out in the field doing things that they haven't done for 20 years or done ever. They're going to be working long hours. They might even be, at a location for 3-4 a week at a time. They're struggling to keep the house and family satisfied as well as that. So it's important that in order to make sure that they're capable of performing, and not just during the strike, but also after a strike, that there isn't any ill effects on your management team. The one thing I have found, though, is with community livings and CCACs, et cetera, healthcare, long-term facilities that have gone through these type of disruptions, one common theme is they can't believe how much stronger their management team got by having to pull together and work through some adversity and some difficult times. So it's, but certainly it's important to have a strategy to keep them recharged and get them some downtime and some time off when they need it. And certainly consider in advance ways to provide some sort of client outings, for instance. It might mean finding a hall or something. Might mean maybe it's a weekly bus trip out to do activities. It is certainly possible to do that. It has been done. It might not be something you might be able to do from day one, but after a week or two, if you're involved in this, it's certainly something to consider, and it's going to make that experience much better. When you're selecting your vendors, certainly, whether it's companies or individuals, it's important to do your due diligence. Check the references. Certainly make sure that they have experience in labor disruptions, not just, signing a contract and planning on doing a strike for somebody that didn't exist. Make sure that you speak to people that they've done the work for. Make sure that their reputation, other people in your industry that have used services are always a good guide to that. Meet with the folks and check the references, that sort of thing. Don't be afraid to ask. Use your network. As I said, the healthcare industry, community livings, for instance, are very, very good at sharing information. They're good at providing assistance, and amongst themselves, they get together, sharing information. Use those networks, and then make sure that that you're not afraid to share that information. And the one thing that I can say is just do your due diligence. So in closing, you know, certainly you want to prepare for the worst and hope for the best. Don't shortchange your planning. It could put you in a very uncomfortable spot. In the 150 contracts a year that I would sign, for instance, as I said, the exercise for not is done by most, but the ones that have done the exercise are certainly very glad that they did. It does mean getting resource together, putting extra time in, asking people to do extra, but it's so critical and so important that it gets done. And speak with the professionals that go through this on a daily basis to help streamline that process. They might have information to share that's going to make your job much easier, and certainly solve some of those problems before they become problems, and solutions before they become problems. I just want to say that I very much appreciate you allowing me to share this information. I hope you found it of some value. And please do not hesitate to reach out to me either by email or calling in. I'd be happy to answer any questions that you have. I would be happy to, if you need a more personal time, be happy to drop out and answer any of those questions. Certainly never a charge on our end to do that, or a simple telephone call. I'd be happy to answer that. So again, thank you very much, and if you're entering into some negotiations in the coming days or coming weeks or months, good luck with those, and please don't hesitate to reach out if you require anything at all. Thank you very much.